go back to the news conference Dr. Birx is speaking.
So right now we're at about 4,000 deaths here in the United States. You're suggesting a spike of more than 90,000 deaths over the next few weeks. Do you have a demographic breakdown of the areas that are most at risk and where most of those deaths may occur?
Well, right now, and I think if you ask Chris Murray, he would say he's using the information coming out of New York and New Jersey and applying that to potentially other states having the same outcomes. I just want to say again, this yellow line, and this is all corrected for 100,000 residents. So this is normalized so we can compare apples to apples. This is still Washington State, this yellow. So they've been able to, for a long time of measuring cases, not have a spike. So it's possible, and we're watching very closely to make sure it doesn't have a spike. But that's what the people in Washington State are doing. This is what every community, Washington State early, about 2 weeks before New York or New Jersey. California, a week before New York or New Jersey. Really talked to their communities and decided to mitigate before they started seeing this number of cases. And now we know that that makes a big difference. Early, as Dr. Fauci said, if you wait till you see it, it's too late.
And again, do you have a demographic breakdown, Dr. Birx, of where these deaths may occur?
So there's a demographic breakdown that we've discussed before related to mortality. And it's as we're seeing in New York exactly what we saw in Italy. Very low mortality, not to say that young people under 30 or young people under 40 aren't getting ill. They are, but most of them are recovering. So the profile looks identical to Italy with increasing mortality with age and pre-existing medical conditions. And so that is holding in the same way. But what we're hoping is that through the work of communities, and again, it comes down to communities. This is communities deciding that this is important to them to not have the experience of New York and New Jersey. And I think, we are worried about groups all around the globe. I mean, I don't know if you heard the report this morning, there's 8,000 ventilators in the UK. If you translate that to United States, that would be like the United States having less than 40,000 ventilators. We have 5 times that amount. So, these are the things that everybody is having to face. And I think the United States is in an excellent position from our medical care position, but we don't want to have to test that system. We want this to be a much smaller epidemic with much smaller mortality.
Can I just follow up on the testing question real quick before we move on? So the testing numbers, I understand 1 million tests done was a big increase, but we were told there would be 27 million tests available by the end of the month. So can you outline where in the supply chain, where in the logistics chain are those other 26? Yeah, where are the other 26 million tests right now?
I think this is just for purposes of clarifications. There's a difference between sending a test that can be administered to a test being done. Because a month ago or more, the president brought together the top commercial labs in America and said, we need you to partner with us to create a brand new system that would rapidly process tests. We're now at 1.1 million tests, and we believe it's a fair estimate that we're testing about 100,000 Americans a day. That'll continue to grow. It'll continue to accelerate. But I think the misunderstanding early on was there were many tests being distributed, many test kits being sent, but under the old system, as the president's described it, the antiquated system, those were being processed in state labs or at CDC or in private labs on a very slow, methodical system that could only produce maybe 30 to 50 tests a day. But this new partnership that we have with commercial laboratories allows the progress we're making. But the breakthrough with Abbott Laboratories now moves to point of care, which means you're going to have devices and tests that people will literally be able to take at their doctor's office, at a hospital, at a clinic, at a nursing home, and have the results in 15 minutes.
So those 26 million tests we were talking about, were those tests under the old antiquated system? And
Yes.
now, so are we still even using those 27 million tests, or have we just completely moved on to the point
The
of
answer
care
is
tests?
yes, now
So
through the new system.
even today, which is, I have to say, coming out of laboratories and developed tests and worked on vaccines and then gone to the field to actually combat epidemics, it is disappointing to me right now that we have about 500,000 capacity of Abbott tests that are not being utilized. So they are out, they're in the states, they're not being run and not utilized. So now we have to figure out, how do we create awareness? Because sometimes when you put an early platform out, like our first platform out in the high speed was Roche. So you get that out, people get dependent on that, and then don't see that there's availability of other tests. So right now, there's over 500,000 tests sitting, capacity, that are not being utilized. So we're trying to figure out, how do we inform states about where these all are? How do we work through every laboratory association so they're aware? And how do we raise awareness so people know that there's point of care, there's Thermo Fisher, there's Abbott testing, and there's Roche. And if you add those together, that's millions of tests a week.
They're not being reported.
And they're
They-
not, and so those are the,
But they're not being reported.
or they're not even being used. So that's what's really, so that's what we're working on.
What's the reason they're being used?
Because when people get used to a single platform, they keep sending it back to that lab. So it's getting in a queue to wait to get on a Roche machine rather than being moved to this other lab that may have Abbott capacity, because they're all in different laboratories. And so I think, well, actually, Admiral Giroir is figuring it out to really create some kind of visual so that every governor and every health commissioner can see all of their capacity in their countries, in their states, county by county, so that they know where the tests are. So we pushed a lot of tests out, but they're not all being utilized.
And it's up to the people when they don't send them back. I mean, they use them, they don't send them back. And Doctor, go ahead, please.
No, Dr. Burks explained it very, very well. I just want to get back, John, to your question. It's a logical question. When you look at the number, you want to know what the demography is going to be. This is a number that we need to anticipate, but we don't necessarily have to accept it as being inevitable. And that's getting back to what I'm saying about, we can influence this to a varying degrees. And if we influence it to the maximum, we don't have to accept that. That's something we need to anticipate. But I want to do, not I, all of us want to do much, much better than that.
On that front, what do the models suggest is on the low end if you have full mitigation?
Well, it says
That was
between
full
100 and
mitigation.
200.
That was full mitigation.
All right, Trump is talking. We're not going to him. I want to go to my first guest because I'm just not understanding what in the hell we just heard. Joining us right now is the president of the American Medical Association, Dr. Patrice Harris. Dr. Harris, I'm sorry. If I'm frustrated because of what I just heard, this is what I don't understand. I recall there being a Rose Garden news conference where CVS and Walgreens and Walmart were walked out there and we were going to have drive-through testing and all sorts of stuff. And then hear Dr. Burke say, oh, we've got 500,000 tests that are in the states that nobody's using. And then you hear Mike Pence say, well, there's a misunderstanding. You know, we're doing 100,000 tests a day. But then you hear the governor of Montana say, don't have enough tests. You hear the governor of Ohio, don't have enough tests. And so, I'm sorry, is there some sort of disconnect between what D.C. is saying and what is actually happening in the rest of America?
Well, Roland, thank you for having me on the show. And you used the perfect word, the word I was thinking about, and that was disconnect. So we are absolutely way behind on testing. And we have asked at the AMA for some sort of national tracking system so we can know exactly where these tests are, because you're right. It's hard to say. And early on, we heard millions, and now we are saying there's 500,000. And I think it's incumbent upon the administration to develop that tracking system, that tool that Dr. Burks, I believe, was just alluding to. That has to happen. Otherwise, there will still be that disconnect. governors and states will still not have the information that they need and the testing capacity that they need. So
it's hard. Okay, I hate Excel spreadsheets, but to me, I don't understand how hard this is. Again, what I don't understand is if you say we sent 500,000 out, okay, how many went to Ohio and went to Florida and Illinois and Tennessee and Georgia? So let's say you sent 50,000 to 10 different states. Okay, then who did you send it to in Florida? Who received it in Florida? Was it signed? And then did they distribute them to counties in their state? I don't understand why this is so hard. And then we were told, I remember, we're going to have 4 million by the end of the week. And then you hear the vice president say, well, that was a misunderstanding. And, saying that there's 1.1 million. That's a difference between 1.1 million tests being done and then them being returned and people don't return them. Well, guess what? If you had drive-through testing, you wouldn't have to have people not returning them because they would be tested right then, placed in a bag, information taken, and then sent off. Correct?
I agree. You're asking the right question, and that's why we have to demand a tracking system. You're right about spreadsheets. I believe, Roland, and I'm not that tech savvy, but it appears to me that some very smart tech savvy folks could develop something relatively quickly. We have to know where these tests are, who has what, who needs what, and then we can prioritize the need. And by the way, we have said that regarding the ventilators and PPE. I mean, we really need a federally coordinated tracking system because you're right, these questions should not be that difficult to answer. And it just, underscores that we are not matching the demand of governors, of states, of local county health departments. And we really need to do so. And testing is a critical way we are going to know the exact spread of this disease.
One of the things that, folks, let me know if y'all have that video. Someone posted a video of what hospital workers are literally going through to protect themselves from coronavirus. If y'all have that video, can you please play it right now? Okay, all right, y'all, find the video. I asked for it to be downloaded, and so please, and what's really just again crazy to me, and I'm going to try to find this video, and it was unbelievable to literally see all of the stuff that doctors are doing and what they're having to deal with, and then you listen to Donald Trump stand there and essentially accuse people of stealing masks and them going out of the door and then questioning, well, why they need ventilators. I read a story last night where in Miami at a Veterans Administration hospital, they are telling people they are going to have to use 1 mask a week. You're a doctor. That's not even the CDC protocol. You're to get rid of that mask after you've seen 1 patient.
Roland, this is the most common concern I am hearing from physicians all over the country. And I know everyone, you've seen the nurses wearing trash bags. And as you say, you've seen physicians reusing masks, trying to sterilize them themselves. And Roland, in typical times, and we are not in typical times, but physicians would have been disciplined or fired for reusing masks because it would violate infection control policies. So again, physicians, we went into this profession accepting some level of risk. This isn't the first infectious outbreak we'll have, and this won't be the last, but there's an accountability contract here. We should have the tools that we need. We should have PPE that we need. It is just unconscionable that we do not have the PPE. And again, another reason the AMA requested of the president to invoke the DPA. Now, this was 2 weeks ago or several weeks ago, and he finally did do that because we need massive amounts of PPE, and it is being used, and it is not being misused, according to the physicians that I'm hearing. They are just trying to do the best they can, and they don't want, candidly, to be infected or to become ill. They don't want to risk their families becoming ill, and it's really not selfish, because if physicians and nurses and we lose other healthcare professionals on the front line, what are we going to do? Who's going to be there to take care of our patients? So this is certainly a workforce issue. It's tragic, and I will tell you, physicians tell me that they go to bed at night sometimes in tears. And we're going to get up the next day and do what we can, but we really need to get PPE in the hands of those who need it. And it's about results. It's okay to talk about it. But the metric for the AMA will be results. And when we don't have the video, I know, or the trash bags or folks reusing them, then we will know that we have the results that we need.
When you talk about hearing from these various doctors, we're seeing people who are posting their own shots. We're seeing photos of doctors literally sleeping in their cars because they are afraid to go home and possibly infect their wives and children. I saw one tweet earlier where this woman, her mom was a retired doctor, and then they call her back into action, said, here are all of the important papers, here's all of the will information, I might not survive this. We are hearing from doctors who are saying that they are operating in war zones, and you juxtapose that with these daily news conferences, and you hear folks say, we got enough ventilators. But then I read one story where one woman was 90 years old, and she said, look, don't even bother, save it for somebody younger, and then that woman died. That took place actually in another country, but we're seeing people make those type of decisions. You talk about the National Defense Production Act. I read another story from the Texas Tribune where there was a particular supplier who has 2 million masks and said they would sell it to a hospital for $6 a mask. They normally cost $1. And yet you have Donald Trump, who's just walking people up there saying, oh, this company is going to produce 50,000 a week, and this company, how great is this? If you invoke that, you can actually use the hammer to say, no, you cannot price gouge. And so even though he signed it, they're actually not really using it. And so, as Cuomo said, now you got hospitals competing with one another, saying, fine, how much you going to pay? Up, well, you're going to pay 6, so forget you. Oh, you'll pay 7, forget you. This is not the way you operate in an international pandemic.
Roland, physicians are writing wills. They are, and as you mentioned, living away from families. But just think about that. Actually, they are updating their wills and rewriting the wills, and I think that just speaks to and underscores the need for federal coordination of this effort again. And so we again continue to call on the administration to use all the levers, as you mentioned. You've mentioned several. In the federal government to make sure that we have the supplies that we need, and it's coordinated. So hospitals are not competing with one another, states are not competing with one another. I believe that, and then we have this tracking system, so we know. You're right. Perhaps right now we all know that New York is the hot spot. Certainly, New Orleans has a great increase in cases. Last week, I live in Atlanta. Last week, our ICU beds were at near capacity. We know the peak is going to hit different regions of this country at different times, and there could be federal coordination. Absolutely, we need to increase the baseline of ventilators, but there could be coordination. But certainly it would be great if the federal government, and we are requesting that the federal government step in and make sure all of these needs are coordinated so that priority areas get what they need. This is going to affect us all.
You're the president of the nation's largest medical group. Has this task force, has this White House called in the AMA and say, what's your advice? What's your counsel? What are your members saying?
They have, Roland. I will say 3 weeks ago, I, along with the leaders of other national medical organizations, had a conference call with the task force and the president. And we raised this issue, and it was my suggestion coming from the AMA. Of course, there was really a lot of consensus among all the groups. And we raised the issue of the need for PPE. We raised the issue of the need for testing. At that time, and this was about 3 weeks ago. And so these are issues that we raise. Now, I will say this, the CMS, the Centers for Medicare and Medicaid Services, have been very responsive around the issue of telehealth. And that has certainly really helped a lot in making sure that patients still have access to care. As you know, many physicians' offices are closed, elective surgeries postponed. Maybe the offices are, 1 to 2 days, hours are different, but we have been able to meet some needs, not all, with the use of telehealth. So certainly there was some responsivity to that. But really, PPE continues to be an issue. The testing, as you know, continues to be an issue. And from our standpoint, the AMA and the nation's physicians, again, it's about results. We can talk about it. But we need more than the talk. We need to make sure that we have results. And again, the metric for us will be when we no longer hear the stories or see the videos that you mentioned of nurses and doctors not having the equipment that they need, or for that matter, be fired for using their own equipment. We really need an all hands on deck approach for this. And look, physicians are going out on the front lines, nurses are on the front lines, and we need accountability back for us to say, yes, you are going out on the front lines, and we want to make it as safe as we can for you, for patients' sake, for your sake, for our healthcare system's sake.
Last question for you. I know that call was 3 weeks ago. But here's what we're also hearing, and this actually, I got a couple more questions. I'm going to ask this one first. It is baffling to me to listen to reports of hospitals threatening to fire personnel if they talk to the media about problems inside of the hospital. I would think this is the last of all moments. This is not the moment where you want to be firing personnel in the middle of a national emergency.
Roland, yet most institutions have a media policy, and that is in the service of coordinating, what is said. But these doctors are speaking out and saying what everyone already knows, right? That we don't have PPE. They don't have PPE. So again, the AMA...
And also, for the person at home, you said, what is PPE?
Yes. PPE is personal protective equipment.
Got it.
And that's the masks, the face guards, the gowns, and those are the N95 masks, the gowns, all of that equipment, which again reduces the risk of a physician becoming infected or infecting another patient. So again, appreciate media policies, but these physicians are going out and really saying what everyone already knows. And so we do not believe that, absolutely do not believe physicians or any other worker should be fired.
Last question. If you talked about being on that call 3 weeks ago, if there was one thing that should be done right now by this task force, by this White House, with the federal apparatus, as opposed to just leaving up to the states, what would you say that one thing is?
Well, I would say the federal coordination and a tracking system and the data, and really that's an umbrella, and then it takes care of all the other things we need, tracking the PPE, making sure, again, as we started this conversation, we need to know, we're glad that Abbott has that new test out, 500,000. Where is it? And let's make sure we get that out to folks so we can act on the data. If I can say one last thing.
Yeah, go ahead.
Data and the science and the evidence is what needs to inform our interventions and the next steps. And without the data, we won't know where precisely to target our interventions. And I just want to say one more thing about health disparities and health inequities. One other piece of data is we believe that, and again, we need to not only know gender, we also need to know race and ethnicity regarding those who are impacted, those who are hospitalized, those who have died. We know something like this just magnifies already existing health inequities. And so, again, we need the data to inform our next steps.
All right. Dr. Patrice Harris, President of the American Medical Association. We certainly appreciate you joining us. Thanks a lot.
Thank you for having me.
All right, then. Folks, I have the video. I want you to like, share, and subscribe to our YouTube channel, youtube.com/Roland S. Martin. And don't forget to turn on your notifications.